Most violent outbreaks in recent years have involved guns, and new information indicates there's often another common thread: antidepressants. From Columbine to Aurora, the Naval Yard to Fort Hood, antidepressants have been linked to violence. For decades, psychiatrist Peter Breggin has studied this link.
That these drugs are causing agitation, anxiety, insomnia, hostility, aggression, mania.
Antidepressants work on the brain, thereby altering the way people think.
In addition to driving the person with this amphetamine-like effect, the antidepressants kind of do a bit of a lobotomy. You lose your empathy. You lose your caring.
In his book Medication Madness, Dr. Breggin cites real-life examples of violence that could be blamed on antidepressants.
Of an engineer who was given Paxil probably to help stop smoking, maybe for some tension, certainly not for any mental disorder. And within a couple of doses, he drowned his 2 children and himself in a tub.
But not all doctors view antidepressants so harshly. The Cleveland Clinic's Dr. Karen Jacobs says without antidepressants, many of her patients couldn't even function properly.
They may not be able to work, they may not be able to interact with their peers, they may not be able to interact with their family. They're really isolated and not very productive. And you can turn a patient's life around by being able to find the right medications.
But she also recognizes the risks.
Educating your patient how to use an antidepressant, what to expect, not only the side effects, but some of the dangers, including making sure that you educate either a caregiver or another family member, is really essential to prevent some of the side effects or detrimental kinds of things that you might have read about in the press previously.
The American Psychiatric Association urges doctors to exercise caution when prescribing a certain type of drug, which includes antidepressants, saying their uses could be harmful, especially if patients aren't properly monitored or are taking other drugs. But Dr. Breggin says when it comes to emotional problems, counseling is the better treatment, saying antidepressants can make the situation worse, especially in young people.
The child who is already angry and upset and withdrawn starts to feel agitated, anxious. Hostility starts to increase, aggressivity starts to increase. The kid has no idea it's a drug effect. Even if you told him it was a drug effect, he might not believe you. He'd say, no, I'm just angry at my schoolmates. I'm just angry at my mother and father because it feels like it.
The Food and Drug Administration receives some of its highest number of violence reports from people taking antidepressants.
It happens often with a dose change up or down, or starting or stopping a change, because that's what jars the brain the most is the change.
So while antidepressants are some of the most popular drugs among doctors and their patients, they can sometimes lead to unexpected and even dangerous results. Lori Johnson, CBN News.